Case study number 5, major depressive disorder. When this case study begins, our client, Carlos, is nearing 40 years old. He has visited the doctor out of fear that he might have a heart condition, but his heart checked out fine. Unbeknownst to the doctor, Carlos's preoccupation with his health began after he lost his older cousin to a heart attack. Carlos is now consumed by thoughts of his own impending death, and these overwhelming thoughts of despair are distressing him to the point of dysfunction. After a second doctor's visit with a bit more discussion, Carlos's physician realizes that he has deeper troubles and refers him to a psychologist. Case study number 5 details Carlos's treatment for major depressive disorder over time through medication and cognitive therapy. How does something like this begin? Generally, we can recognize some common first signs that a person might be depressed. Those who visit a physician might complain initially of general illness, pain, or fatigue. Most complain of general illness, followed by pain, and a small percentage, fatigue. We can also look at a checklist of behaviors that happen over a 2-week period, such as a depressed mood for the majority of the day, decreased enjoyment or interest in most activities for the majority of the day, and then at least 3 to 4 of the following, like weight or appetite changes, changes in sleep habits, or changes in agitation, decreases in motor activity, just daily fatigue or lethargy, daily feelings of worthlessness or excessive guilt, daily decreases in concentration or decisiveness, and a repeated focus on death or suicide, a suicide plan, or a suicide attempt. We can also see that a person might be depressed if they are experiencing significant distress or impairment in their life. So as you may remember, Carlos initially saw his family physician to determine whether or not he had a heart condition. He asked for an EKG to be performed. It checked out fine, but he went back, and on his second visit, his tearful reaction to the doctor's suggestions is really what prompted his physician to suggest a psychologist. The psychologist, Dr. Willard, after consulting with Carlos and hearing his symptoms, advised Carlos to seek psychological treatment. Dr. Willard also referred Carlos to a psychiatrist who could advise and prescribe antidepressant medication. Carlos saw Dr. Sue, and Dr. Sue's medication approach was to prescribe Prozac, which Carlos tried for a few days before deciding he couldn't stand the side effect of feeling constantly jittery. So they tried another medication. They tried Zoloft, but it didn't help very much either, and it also had negative side effects. Carlos had opted out of psychotherapy for the time being, and his thoughts continued to spiral to the point where he refused to go to work. So Dr. Sue decided to hospitalize Carl so that an intensive search for effective medication could take place in that environment. That was pretty tough on Carl. This was also hard on Carlos's wife, Sonia. And Sonia had several concerns throughout this time. The biggest thing for Sonia was that she had seen Carlos change as a person from a confident, hardworking, caring father and husband to just a very sad and scared and even self-centered shell of himself. He couldn't function anymore, and he was impossible to reason with. Sonia really just felt like she had lost Carlos and that her children had lost him as well. Even after Carlos found a medication regime that helped somewhat, he still didn't feel like himself. He was still very depressed. So this time he agreed to see Dr. Walden, who used a cognitive therapy approach. Dr. Walden diagnosed Carlos with a major depressive disorder based on the following facts. Carlos had exhibited a depressed mood most of the time. He didn't have interest or pleasure in his usual activities. He had trouble sleeping, and he had lost both energy and ability to concentrate. Dr. Walden proposed addressing this through concentrated, intensive treatment of psychoeducation, self-monitoring, self-examination, sustained questioning by the therapist himself, personal research, and retraining in how to think about things. Carlos was really interested in knowing how long this was going to take, but Dr. Walden didn't want to give him a definite timetable. The psychologist was just concerned that if he gave a specific date for Carlos's recovery and Carlos hadn't met his expectations, then Carlos would be really upset and have more fuel for his negative perceptions on life and on himself. So Carlos agreed. Carlos's first assignment during his first week of therapy was to monitor his emotional reactions over the following week. Any thoughts that distressed him were to be recorded and rated according to their intensity. And then a second part to his assignment was to record all of his activities. In the second session, they came back and discussed this. His second homework assignment for the second session was to continue his record keeping of distressing thoughts and emotions. And Dr. Walden asked Carlos to change it up a little. In the second week, though, he asked Carlos to try to think of more truthful, evidence-based thoughts and then write them down, replacing the negative thoughts. Second, Dr. Walden assigned Carlos 2 activities. 1, getting up and leaving for work at 8 o'clock a.m., the same time he had left before he became depressed. And 2, reading a bedtime story to his children at night. Carlos was asked to keep notes on these activities as well. Dr. Walden was hoping that through this evening activity especially, it would test Carlos's assumption that he was barely able to function and that any added stress would make his disorder worse. Dr. Walden also addressed the marital tension that Carlos's disorder had caused. Carlos's wife, Sonia, had for some time now been the only responsible adult at home, with Carlos being unable to function. So she just felt really angry and frustrated and resentful, especially because this had gone on for about a year. And in keeping with his thinking patterns, Carlos's attitude towards her resentment was negative, so it didn't build any bridges between them at first. Dr. Walden encouraged Carlos to replace those thoughts with more rational thinking, and Carlos learned to show more understanding towards his wife. He thought that she did really have a right to be frustrated with how things had been, and that she really had been pretty understanding with him. Now, since Carlos hadn't gotten much relief from the medication, Dr. Walden contacted Dr. Sue, and Carlos had given permission for the 2 professionals to consult so as to coordinate treatment plans. Dr. Walden asked Dr. Sue if he could add an atypical antipsychotic medication to the regime, and Dr. Sue agreed. Often, the medications that are used to treat schizophrenia or other psychotic disorders can amplify an antidepressant's benefit in people with treatment-resistant depression, which is what Carlos appeared to be struggling with. So Carlos experienced full functioning between weeks 10 and 14 of his treatment. But when he started feeling better as a result of the treatment plan, his doctors agreed to keep him on his medication rather than quit. Studies show that people who stop taking drugs right after finding relief are at a 50% risk for relapse within the next 12 months. So this risk shows a significant decrease, if the medication continues for about 5 months after being symptom-free. And his doctors wanted to give him the best chance possible for success. As I was thinking about this case, I just really connected it with the experiences that I've had with either mild or major depressive disorders. I really didn't have a lot of misconceptions that were cleared up just because the case matched so closely with what I've seen in friends or family or in myself. And one thing that really struck me, though, was what Dr. Walden said about dead time. Just the fact that there is no such thing as doing nothing. The mind is always active. If it's not engaged in one thing, it is engaged in something else. So it's just a really good reminder for me personally that I am the gatekeeper for my thoughts and emotions, and I don't want to base my life on what I'm feeling. I need to address the thoughts that are going through my mind, and confront them if they're irrational. I just liked the fact that the point he said was to keep the mind busy with replacing irrational thoughts and destructive activities with rational thoughts and constructive activities. That's just really practical things that we can all do, I think. And I really liked that Carlos was able to have a coach like Dr. Walden to meet with one-on-one. And my question, or a question that arose from that, was what would have happened if Carlos hadn't followed the suggestions of his family and care providers for treatment? Because he really went along with the plans that were advised, but there are a lot of people who are much more resistant. And what can we do to encourage them to seek it? What can I do? I don't really have the greatest history in responding to people with depression because it really is so frustrating. And I felt a lot like Sonia, Carlos's wife, just really angry and resentful. And when it's my close friends or family that are going through it, just, I hurt for them. And I have been empathetic, but I've also felt really helpless and kind of hopeless as what to do. And I have become depressed myself, which is, I've been one of the 20% that the book talks about, which really doesn't help. There are some resources that did help me and have helped me to cope in this situation. And if you are going through something like this, if you know someone who is, I hope that you can find some good resources as well. I just put a couple on here. I just skipped past it. Let's go back. Okay. Just a couple of resources on here that helped me. I know the pictures are rather small, but I'll leave it on here for a minute so you can see the link. Sometimes it's just hard to know what to do, and the web has a lot of great things, but these books were just really full of helpful information. Thank you so much for listening.